Hi students, welcome to our oral pathology sessions. In this video, we are going to discuss about a small topic that is your developmental cyst. Okay, they are classified under non-odontogenic cyst. Okay, so we are going to discuss here about your non-odontogenic cyst. Okay, non-odontogenic cyst. So these cysts that arise from epithelium other than your odontogenic epithelium. Okay, the cyst will be seen in the maxilla or the mandible or your alveolus. In the tooth bearing areas, the cyst develop, but this cyst is not because of your odontogenic epithelium. Okay, they are arising from some other epithelium, mostly those epithelium which get entrapped between the developmental process. You have when the face develops, you have many processes: your maxillary process, mandibular process, median nasal, lateral nasal, and you have many what processes developing at that time. So in case when this process develop, if the superficial epithelium get entrapped within this at the fissures, okay, at the joining of this process, then this epithelium may get a trigger in the later stage of life and they will develop to a cyst. Okay, those are called non-odontogenic cyst, or we say fissural cyst, because these occurs in the fissures, okay, of joining. So that is non-odontogenic cyst or fissural cyst. Now, most important from in this is one cyst which we have to learn is your nasopalatine. Nasopalatine cyst, or we say incisive canal cyst, incisive canal cyst, or median maxillary cyst. There are so many names for this. Mainly nasopalatine cyst or incisive canal cyst. Now, as the name indicates, it is occurring in the incisive canal. Okay, incisive canal in the maxillary region, and where you know the where this incisive canal opens in between the roots of your two maxillary central incisors. Okay, that is your pure anatomy. Now, which is this is the most common non-odontogenic cyst. Okay, the most common non-odontogenic cyst is your incisive canal cyst, or we say most common fissural cyst. Okay, that is your incisive canal cyst. And from where the cyst is originating, what is the cause of origin? You know that there is a structure called nasopalatine duct. Nasopalatine duct. This nasopalatine duct is present in the what embryonal stage, but later it get what removed. Okay, it get removed during the course of development. But if some remnants of this nasopalatine duct is remaining there, okay, if some remnants of this nasopalatine duct is remaining there, what happens, this remnants will later trigger a formation of a cyst. So this is occurring within the nasopalatine canal. So nasopalatine canal in the embryonal stage, they have this nasopalatine duct in it, but as there is a development, what happens is that this nasopalatine duct that gets what removed. Okay, that is vestigial and that gets removed. And what happens is that any remnants of this nasopalatine duct, if get triggered, they form the nasopalatine cyst. And the origin, now if you take the radiograph of the cyst, from where it is seen is that you can say, can you see this picture? Yeah, this is a picture of your nasopalatine cyst, or nasopalatine duct cyst, or we say median maxillary cyst, or incisive canal cyst. Okay, can you see this in the incisive canal region? You can see that cystic swelling there, and you can see this radiograph. You can see in between the roots of two central incisors. This is one maxillary central incisor on the right. On the left, there is two central incisors. So it comes exactly in the midline. Okay, so there is two central incisors there in between the roots where the foramen of that your nasopalatine foramen opens. Okay, so there the cyst is developing, and you can see a heart shaped or a oval shaped. Okay, shape doesn't matter. The shape of the radiolucency doesn't matter. Always the location matters between the roots of two central incisors. I still say between roots of your central incisors. Okay, shape doesn't matter. They may say a round shape, they may say a heart shape, they may say inverted pear shape, whatever it is. Okay, inverted peer, whatever the shape be, if it is between the roots of two central incisors, it is most probably a nasopalatine duct cyst. Now, histopathology is not that important. In histopathology, what you see is, you see sometimes you see epithelium which is pseudostratified, sometimes it is columnar. It is very, very variable. Sometimes it is simple columnar. So they won't ask you histology in this. Histology doesn't matter. You should know about the location of the cyst. Now, next cyst is a nasolabial cyst. So, second one is nasolabial. Okay, now what is there in the nasolabial cyst? What is the peculiarity of nasolabial cyst is that this cyst arises in the soft tissue. This is a soft tissue cyst. Soft tissue cyst. And the reason for the nasolabial cyst is that it arises from the remnants of your nasolacrimal duct. Nasolacrimal duct. Its origin is from the nasolacrimal duct. So the nasolacrimal duct, the cells from this nasolacrimal duct will develop into this nasolabial cyst. This is the most accepted theory. Some say that there is one more theory in this origin. Some say that it is due to the epithelial entrapment. It is due to epithelial entrapment. Okay, epithelial entrapment between your median nasal and lateral nasal process. Median nasal and lateral nasal process. Okay, so this is also one other theory which is pointing towards a fissural cyst. But some say that it is a remnants of nasolacrimal duct. Some say that it is a epithelial entrapment between your median nasal and lateral nasal process. That doesn't matter. They have never asked you this. But the interesting thing they have asked question in this is nasolabial cyst occurs in the soft tissue. So what about the radiograph? It doesn't have a radiograph. There is no evident or no striking radiographic feature. Okay, no evident or no striking radiographic feature. That is about the nasolabial cyst. Okay, so histology is not important. They have a variable histology. These things, this fissural cyst lining is not important because they always have a variable lining. Sometimes it will show pseudostratification, sometimes simple columnar, sometimes tall columnar, sometimes squamous. Okay, so that is very variable. Now, last one, there is a cyst called a globulomaxillary cyst. You may have heard about globulomaxillary cyst. Actually, this is a misnomer. We don't use this term now. There is nothing called a globulomaxillary cyst now. Okay, so globulomaxillary cyst, it usually comes in a location. Okay, the location is very much important here. Okay, so it is between the location, it always comes between your lateral incisor and canine, your maxillary, lateral incisor and canine. So this globulomaxillary cyst, the globulomaxillary region is between your maxillary, lateral incisor and canine. So there you see a inverted peer radiolucency. Inverted peer radiolucency, what you see there. And they were called as globulomaxillary cyst in the previous times, but now we don't use this term. Why we don't use this term? Because when sometimes there is a swelling in the lateral between the maxillary central and lateral incisor, we remove the cyst and we see it will show some features of radicular cyst. Sometimes it will show some features of OKC. So sometimes it will show just a stratified lining epithelium. So we don't know what exactly this cyst lining is. Okay, so there is no exact lining for this cyst. There is no exact behavior of the cyst. So we avoided the name globulomaxillary cyst and we just gave the name cyst of the globulomaxillary region. Cyst, just call them by the name cyst of globulomaxillary area. Okay, cyst of globulomaxillary area, because of its variation. We don't call, there is no single entity called a globulomaxillary cyst, just location. So I am telling you, you should be very careful about the location between the roots of two central incisor. It is your incisive canal cyst. Okay, and globulomaxillary cyst comes, or cyst of the globulomaxillary region comes between lateral and canine. Okay, so this is the most important point you should know in non-odontogenic cyst. Now, let's see if there is any question being asked in this. Okay, there is a question being asked here. Okay, a 26-year-old female patient presents with a swelling in the right and left side of upper lip. So on the upper lip, she has a swelling. Now, the radiographically, what about the radiograph? Radiographically, there is no evident findings. Okay, so that is the thing. There is no radiographic finding, and the histological appearance is shown in the picture. So they have given a histology also. Now, I just want you to identify whether it is a cystic lining or not. Okay, so whether it is a cystic, the epithelial, the picture given here, whether it is a cystic lining or not. Can you identify the lumen? Can you identify the lining? Okay, so I can understand the lumen here, and I can see a epithelial lining here. So this is epithelial lining. Don't worry about the what type of epithelial lining is here. It doesn't have, there is no retar ridges. Okay, there is no retar ridges in this, so it is an epithelial lining. So I can understand that this is a cyst actually. Okay, this is a cyst, and hence I can omit the option D. It is not an adenoma or something. It's a cyst. Now the question is between mucus retention cyst, nasolabial cyst, and median palatine cyst. Okay, median palatine cyst has comes in the midline of the palate. Okay, and but here they are saying that it is on the lip. So mid palatine cyst is by the location, it is in the palate. Okay, they are saying that it's on upper lip. So I can omit option C. Now I have doubt that a mucus retention cyst and labial cyst. You know, mucus retention cyst is your mucocele. Okay, it is a mucocele what they are talking about, and nasolabial cyst. Both doesn't have any radiograph. Neither your mucocele has radiograph nor your nasolabial cyst has radiograph. Mucocele is an extravasation phenomenon or retention phenomenon, whatever it is. It doesn't have such big thick lining. Okay, so the cystic lining, you can see a cystic lining here, and that cystic lining and related to upper lip. Mucocele usually comes in the lower lip, right? So most possible answer, most favorable answer here is your nasolabial cyst. So this is how you come to the answer, by omitting out the wrong answers. Okay, omit it, don't guesswork, don't do a guesswork. Try to omit out the answer, then you will be more close to your right answer. Okay, this is what is there in a non-odontogenic cyst. I hope you understood the major non-odontogenic cyst things here. Okay, they won't ask you much in your non-odontogenic cyst. This is one question, and they have given a clue also, radiographic evidence and all. Okay, they are focusing on nasolabial cyst, which doesn't have any radiograph. Okay, so I hope you understood the session. See you in the next video with a new topic.